The ventricle in aortic regurgitation usually shows volume overload. What does that mean? Well, it means that the ventricle is dilated and rather hyperdynamic. Why is that so? Well, because the ventricle is actually filled from two sides at the same time, from the left atrium and also because of aortic regurgitation from the aorta. Usually you will have higher end diastolic volumes and the preload is increased in aortic regurgitation. But then there's another very important factor. In contrast to mitral regurgitation, where we have a reduction in afterload, patients with aortic regurgitation show an increased afterload. There's an increased end diastolic volume and an increased wall stress. Now, this increased afterload plays a very big role. First of all, ventricles in aortic regurgitation will not be as hyperdynamic as you will see them in mitral regurgitation, and you can actually expect that if someone is operated and we then reduce the afterload, that the ventricle gets better after operation. This is in contrast to mitral regurgitation, where left ventricle function will usually deteriorate or get less after the patient is operated and mitral regurgitation is treated. But in essence, when it comes to the way we manage asymptomatic patients specifically, it's not much different than how we approach patients with mitral regurgitation. We try to figure out the best time to operate in these patients, usually when left ventricle function deteriorates and obviously if the patient develops symptoms. So we also use an approach of what we call watchful waiting. Again, the question might be, well, why don't we operate on these patients earlier, before we even come into some form of risk that left ventricle dysfunction develops? Well, the same holds true as for mitral regurgitation as well. We have complications of cardiovascular surgery. Patients, again, could die. We have complications of prosthetic valves. Again, the problem of valve thrombosis or paravalvular leakage. And of course, leading risks because the patients are taking anticoagulation. And we do also see patients with unsatisfactory results where, patients might not benefit as much as they actually should from surgery. So we try to delay the time to surgery in many patients as late as possible, but still at a time where the left ventricle function is not deteriorating yet.